amendment for the ceiling of 100,000.
Is there discussion on the amendment? All those in favor say aye. All those opposed, please raise your hands. The amendment passes unanimously.
Move the bill as amended.
Second.
Discussion on the bill is amended. All those in favor say aye. All those opposed, no. Please raise your hands. The bill appears to pass unanimously. House Bill 299, Tyler.
House Bill 299 provides for the licensing of genetic counselors by the State Board of Physicians, along with necessary details and regulations to carry out the law. And there was an amendment adopted in subcommittee conforming with the Senate crossfile that specifically provides for laws provisions for genetic counselors in training. It passed unanimously in subcommittee.
Delegate Kelly.
Thank you, Madam Chairman. Yeah, it was unanimous in committee and the sponsor did a great job. We need to move the amendments first.
Is there a second?
Second.
Second. All those in favor say aye. All those opposed, no. The ayes have it. Actually, I should say raise your hand, and there are no hands. Delegate Kelly.
I meant to add that all the stakeholders were on board and the Board of Physicians was comfortable with this. So wanted to make sure everyone knows that. Move the bill as amended.
I wonder how they managed to do that.
And nothing like a little pressure, I think.
Well done. All those in, is there discussion? All those in favor say aye. All those opposed, no. The ayes have it. And it's unanimous. I see no hands in the column. House Bill 301, Tyler.
Bill 301 would bring provisions to the Maryland Revised Uniform Anatomical Gift Act. Specifically, it, as drafted, would provide that individuals who are registered to be an organ donor, such as through the MVA, it would expand. Right now, current law, organs are only donated for transplantation and for therapeutic use, and the bill would have expanded it to include use for research and educational purposes. But now, there was two amendments ultimately adopted in subcommittee. One specifically providing for a grandfather clause so that the change only applies if you've updated your registration or a new register for the program. And then a second one that would provide for choices for individuals. So when you go to enroll, you can elect which of the uses you would be registering for, as well as a number of transparency and general educational requirements to help make sure that Marylanders are aware of the change and understand the choices that they would be making when registering. After a lot of work with the sponsor and stakeholders, the amendments were adopted unanimously and the bill was passed unanimously.
That is thorough summary. Also add that we also provided that it would not be the obligation of MVA to make this material available or explanatory material that would be given to them by the advocacy group, but they wouldn't have the burden of, it's not a shall, it's a may. So move the amendments.
Second.
Wait a minute. They may be responsible for the giving out the information?
So they are responsible for giving it out. It was just the clarification was that it's up to the Donate Life Maryland as the official organ donation program for the state makes the educational material, and then MVA is just obligated to make sure it is displayed prominently and available at their locations. So I was concerned that was putting a burden on MVA. And so it's just clarifying that it's once Donate Life makes these new materials, then MVA will be displaying them.
It's in terms of the display, may prominently display.
May prominently display.
Each MVA location may prominently display the educational materials.
It should help. Whoa.
I don't think
First of all, we need to make sure that the materials are printed and given to the MVA before the program starts. And second, they shall be displayed because if they may be displayed, they may not be displayed, and people won't know what they're doing.
So Delegate
Delegate
Rosenberg, that was the
Discuss?
we
Well,
were
there-
towards that understanding, and then when we took more time, read through and understood how that subparagraph 1 and 2 work together. If one of the other members of the subcommittee wants to,
Yeah, we left, I was concerned with the shall, and we talked, because MBA is not required to print and have the materials, they're gonna get the materials to MBA, and then I was okay with MBA shall put them out. I just didn't
Okay.
wanna, I wanted MBA to, so Delegate Rosenberg, what, we discussed it, but we left it with shall.
I stand corrected.
So how do we know that the materials will be given to the MVA before the program goes into effect?
It
The
says in the
organ
bill.
procurement organization shall produce and provide to each motor vehicle
The
administration.
paragraph before that.
Right.
In a timely, I mean, what's the timing of it? When does the bill go into effect and when does the materials have to be printed?
I think the bill goes into effect 22, right?
When the regulations take effect, yes.
right, so the entire bill, would now be amended January 1, 2022. And then most of the applicable provisions are when MDA has been able to adopt the necessary regulations to carry out the program. So it gives everyone approximately a 6-month time period.
I still don't hear how we know the materials will be printed and displayed before people walk in the door to renew their licenses or get licenses. Can you clarify that for me? Or should we hold the bill?
I would say in as much as you can trust that Donate Life Maryland, the organ procurement organization of the state, is tasked with doing something in a timely manner, that they will be capable of putting together the educational materials.
I'm sure they will. I
Madam
just
Chair?
don't know when. Yes.
Be helpful to actually have that section read aloud. I think your questions about the may and shall are on point. We thought we worked it out, but we might not have. Maybe we should just hear it
We're
aloud.
going to hold this bill. I want to make sure that that those materials are printed and distributed to the MVAs before the law goes into effect. Otherwise, people will be clueless what they're doing. So we'll hold that bill. Sorry, House Bill 416. Lisa.
House Bill 416 requires the Maryland Department of Health to establish training and staffing requirements for Alzheimer's special care units and assisted living programs. The amendments require MDH to establish for Alzheimer's special care units and assisted living programs the number of dementia-specific training hours for staff, the topic content of the training requirements, and sufficient staffing requirements to meet the needs of residents. The amendments also require MDH to convene stakeholders to make revisions to assisted living regulations dated September 30th, 2016, and adopt revised regulations by December 1st, 2022.
Delegate Kelly. Are you unmuted, Delegate Kelly? Are you there, Delegate Kelly?
She was here. She appears. There we go.
She was having connectivity issues.
Are we on 299? I fell off. I was having some technical
Yep.
difficulties. Okay, let me keep my
We're-
video off. I think that will help.
Wait, we're on 416.
Oh, wonderful. Okay, so 416 is the Belcastro bill, right?
Correct.
So this is a wonderful bill. We need to move the amendments. The amendments, I just want to say, are the result of a tremendous amount of work by the sponsor as well as the senator who sponsored the cross-file. A lot of advocates to corral on this, so I just really want to commend her. But with the amendments, we had unanimous, all the stakeholders were in support and had unanimous support from the committee move the amendments.
Second.
Any discussion on the amendments? All those in favor say aye. All those opposed, no. Please raise your hands.
And then I would like to,
Yeah, move the bill.
move the bill as amended.
Second.
Discussion. All those in favor say aye. All those opposed, no. Please raise your hand. The
I
bill
had-
pa-
I had discussion. I have my hand up for discussion.
I'm sorry. I didn't see it, Delegate Shalega. Bad me. You go ahead.
I just want to make sure that leading ages, their concerns in the testimony were addressed and they're on board with what this bill is today.
Yes,
Very well,
absolutely.
Miss.
This bill went through a lot of changes with the amendments, both in the Senate and then further amendments in the House, and all of the stakeholders are on board. And I think this is going to be a really good thing for us and for our assisted living facilities and memory care facilities.
That sounds great. Thank you.
All those in favor say aye. All those opposed, please raise your hands. The bill passes unanimously. Good job, Delegate Belcastro and Delegate Kelly. What a team. House Bill 448, Tyler.
House Bill 448 would establish June 19th as a state holiday annually for Juneteenth.
Delegate Rosenberg.
Yeah.
Subcommittee felt that this was an appropriate holiday for state workers to observe because of the historical significance of the date. It was a party line vote. Move the bill unamended.
May I ask?
Discussion? Is there discussion?
I just want to, I agree that it should be commemorated. My concern with the bill is you keep giving state employees all these days off. I think they should celebrate it. But we got to start going to a flex day or something, because pretty soon we're going to be at like 30 state paid holidays. That was my only point on the bill. I understand that it is something that should be celebrated. I just think eventually we got to decide how many days we're going to let all the state employees have off.
Okay.
I believe this is the 13th. Is this the 13th state holiday?
For this year?
No.
In total, yes.
By statute, yes.
Is there any further discussion? All those in favor say aye. All
Madam
those-
Chair,
There's
got my hand
hands up.
Got
There's
hands up.
hands up.
I apologize. I am so sorry. Delegate Krebs, then Delegate Saab.
First of all, it's been my experience that we negotiate state holidays through the bargaining process. And I'm looking here and I sort of feel like we're just on a spending spree. This says millions of dollars for overtime expenses for relating to providing employees with an additional state holiday. Do we not have any limits anymore? It's just like a free for all. I mean, I just, I'm like, it's shocking to me. I think if we want to make good policy, we look at the holidays that people get and take some of them away and let people choose what holiday they want. I mean, people complain about Columbus Day. Okay. Let these be flex days and let people pick which holidays they want to, instead of just keep adding one for millions of dollars. It's like, did they even consider the fiscal note? And then we usually bargain these things through the bargaining units. That's how we've always done it in the past.
I'm pretty sure certain state holidays are by statute.
They are by statute, but usually they're bargained. I mean, whether they're a paid state holiday. I mean, there's something called a legal holiday and there's something called a state. Now we can make it a legal holiday, which I don't know if we did that yet or not, which is fine. Now, whether or not the state employees get off on that day is something that we negotiate. So we've got a lot of legal, we've got Good Friday as a legal holiday. Maryland Day is a legal holiday and they have off for that. Why don't we, I mean, discuss it with the bargaining units, let's swap something out. If they want Juneteenth Day off, give up Maryland Day. Does anybody know when that is? They're off on Maryland Day, March 25th. Give that up and make it June. I don't know, but just to spend millions of dollars on a new holiday, I'm like, I'm sorry.
Delegate Rosenberg, can you explain the background of Juneteenth for our benefit so that we can be reminded why we're doing this?
Listen, I don't mind the day itself at all. I have no problem with the day. I have a problem with not figuring out how to, how do we normally decide whether people get compensated as a day off and whether we want to spend millions of new dollars on a new day versus swapping something out. That's what I'm not arguing about the significance of any of these days. I mean, I never even knew when Maryland Day was, but we're all for that too this month.
Okay.
This Juneteenth is a celebration of the emancipation of those people who had been enslaved in the United States. And has been given greater prominence in recent months and year. And therefore, the committee thought it was an appropriate holiday to celebrate. Let me see what else.
I think the bill is the way it is. If you have an amendment, we can consider it, Delegate Krebs. Otherwise, we're going to vote the bill up or down. I
Anyone
can't hear
talk
you.
to, did anyone speak to Department of Management and Budget about how you normally negotiate these? I mean, again, I don't, if the state employees want that day off versus another one, I don't care. It's just the fiscal impact. You know, I was just told by the chair that I have a bill for $200,000 and, oh, that's a little much. And this is millions of dollars. We have no idea for an extra state holiday. And it says, boom, let's pass it through. And, you know, again, it's not about, it has nothing to do with the day. I mean, I picked that over Maryland Day. I'm sorry. But, you know, we didn't even discuss substituting something or asking them to bargain for it. And maybe they
Made your point. I think you've made your point.
Okay. So we're just gonna, all right. I'm tired and I'm hungry.
You and me both. I'm going to move on to Delegate Shalega, then Delegate Hill. Delegate Shalega, you must be muted.
Sorry, I was muted because I have the fiscal note up in front of my muted button. Reading the fiscal note, I support this holiday. I don't want it to be inferred that I don't think that this is an important day to be commemorated. When you look in the fiscal note, it has 4 categories: school holiday, bank holiday, legal holiday, employee holiday. So I would offer an amendment to make this a legal holiday, which wouldn't guarantee and not an employee holiday off. Employees currently get 12 paid days. This would be the 13th paid day. That's 2.5 weeks of time off. And I just feel like giving an employee, state employees, a day off today, when so many friends of mine are losing their businesses, our employees are our staffers here are spending hours every week helping people with unemployment claims. Restaurants are closed, people are out of work, and I just don't feel right giving state employees another paid day off in the midst of a pandemic when people aren't working. People don't have a job. But I think a compromise could be to make it a legal holiday to recognize the importance of this day. And then, as Delegate Krebs said, if they want to bargain it, fine. But then we're, you know, meeting our objective.
So are you moving an amendment, Delegate?
Yes, I would like to move an amendment to make the Juneteenth National Freedom Day a legal holiday.
Second.
Okay, is there discussion on the amendment? All those in favor, Delegate Hill? You're muted, Delegate Hill.
Yeah, thank you. I was just trying to find the button. So I like the idea of a flex. I'm not clear the difference between the legal versus the other. I'm not sure you changed anything there. And we have the option to say that they can use it, that it's a legal holiday. They only get 12. That we list 13, you only get 12, and you decide which of the holidays are the, you don't
Let me
take.
clarify, Delegate Hill. If you look in the fiscal note, a
I'm
legal
looking at it.
is a holiday that doesn't mean that you're a paid day off of work. It's acknowledged as a legal holiday. And then there's another category called employee holiday. So there's 4 categories. So my amendment, it makes it a legal holiday, but not an employee holiday.
Isn't it already a legal holiday though?
It is.
Under the
Well,
bill.
No,
No.
not,
Bill, it
it's
would be
not.
It's a
legal.
commemorative day. It's a commemorative.
It's not
Oh, I
even
see.
listed.
Okay, I'm not going to get into bargaining issues. I'm not going to get into
Well,
the,
the vote
that-
set, I mean, the amendments on the table.
right. So I'm going to limit it to the amendment. I see Delegate Hill, did you speak or you wait?
Before the amendment was made, I was going to propose an amendment to make it a flex holiday, but that's not a category.
No, it's not something we can do. That's more.
Right, no,
more
but there's an amendment
complicated.
on the table. I just wanted to be clear about
Okay.
what that does. And the fiscal note did not define the legal the employee holidays. It didn't define the legal holidays for me. So I want it to be clear.
It
Are you clear
actually
now?
it's in the fiscal note.
Are you clear now, Delegate Hill?
No, I'll read the fiscal, I'm trying to read the fiscal note to get clarity. That's all.
A legal
Thank you.
holiday means it exists. A paid holiday means it exists and people get the day off.
Right, a paid holiday is not one of the categories. That's all.
Well, this is a paid holiday, so that's interesting. Tyler, can you shed any light on this?
So my understanding is that employee holiday might be the closest to what
Oh.
most people think of by a paid holiday. So a day that you're required to take off, or if you work 24 hours, you would receive overtime.
So does this bill say employee holiday? Is
It
that,
would
Yeah.
be both. Yeah, it would be an employee holiday and a legal holiday in the
Good.
bill.
Yes.
thank you for that clarification. And thank you, Delegate Hill, for that very good question to clarify it in everyone's minds. Okay? Are we clear?
Yeah,
Is there
it says the
anybody
legal
that has-
holiday must be observed. That's the difference. You get paid for both of them. I don't think making it legal stops addresses the concerns about the money. Tyler, does it? I don't think that addresses that concern.
Well, if you look in the fiscal note, it says it says February 12th, the Lincoln's birthday is a legal holiday, but it's not an employee holiday. And Easter Monday is a school holiday, but not an employee holiday. So they've got them categorized.
No, I see that. That doesn't tell you which one you get paid for. It talks about you get paid for an employee holiday. It
Yeah.
doesn't discuss at all whether you get paid for a legal holiday. You're assuming you don't. I don't
You
think
don't.
that's true.
Yeah, I think that's the difference between a legal holiday and an employee holiday.
Tyler, do you feel comfortable with that answer? If not, we're going to hold the bill.
It
till-
says, you can hold it, it says right there, and state employees required to work on an employee holiday, so you get paid, receives compensatory time for that work. An employee not scheduled to work on an employee holiday, but otherwise required to work is eligible for compensation. And if you're required to work, you get overtime. So the overtime is what they're talking about.
But that's the employee. They don't tell you the same information about the legal. They just said
The
the
legal
legal
holiday is
requires that you
just-
take it on that date.
Because that's
That's all
not,
they-
that's not a negotiated holiday. It's just a legal holiday for the state of Maryland. You don't get paid.
Okay, we're going to assume that this is correct, that a legal holiday is a legal holiday, but a paid holiday or an employee holiday is a paid holiday. I will have Tyler double check that just to make sure we're absolutely right. I don't need to then hold the bill. I have some hands up. I think they're on the amendment. I'm going to start with Delegate Saab, then Rosenberg, then Barron.
I'm going to yield my time to someone else. My concern was the same thing we just discussed, so thank you.
Okay, Delegate Rosenberg?
This may be redundant, but the bill as it is now written, it would be both a legal and an employee holiday, which is the case for the vast majority of holidays. Thank you.
Delegate Barron?
Thank you, Madam Chair. At the risk of stepping out here, I think we should support the amendment. I think that the basic idea here is to recognize this day in as a legal holiday. I don't think it's important. The rest of the stuff is whether people get days off or not. I think the important thing here is just honoring this day and what it means in this significant way. And the rest, I don't think has much importance. And if this will get the bill consensus support out of this committee, I think it's well worth accepting the amendment.
Thank you, Delegate Barron. I'm going to hold the bill. I've got 5 more hands and I'm going to hold the bill. Because it's 9, is it 9:40? Is my clock right today? I can never tell anymore. They
Yes,
so
yes, it
many
is.
times. Thank you. Okay. I'm just holding that bill. Next, House Bill 565.
This bill outlines requirements related to hospital debt collection policies and payment plans, and it prohibits a hospital from taking specified actions when collecting debt. A hospital must submit an annual report to the HSCRC that will provide data related to medical debt collection in the state. There were amendments adopted in the Health Insurance and Pharmaceuticals Subcommittee that strike provisions of the bill that would have required hospitals to provide certain refunds or seek to vacate certain judgments against patients later found to be eligible for reduced cost care, prohibits a hospital from charging interest or fees on certain debts incurred by patients who are eligible for free or reduced cost care, requires the HSCRC in consultation with stakeholders to develop guidelines for an income-based payment plan, prohibits a hospital from seeking legal action against a patient on a debt owed until the hospital has established and implemented a payment plan in accordance with guidelines established by the HSCRC, strikes language that would have prohibited a hospital from filing an action against a patient to collect a debt owed on a hospital bill in an amount of $1,000 or less. The amendments set forth the stakeholders from whom the commission must seek input when establishing the payment plan guidelines and requires the HSCRC to report on the guidelines on or before a certain date. The amendments require the commission to conduct a certain study on uncompensated care and require the Maryland Healthcare Commission to conduct a certain study on using the state designated health information exchange to support determination of financial status for purposes of determining eligibility for free or reduced cost care. And the amendments make the bill effective January 1st, 2022.
Delegate Cullison, who has labored on this.
Thank you, Madam Chair.
Hard.
This was a challenging bill. The advocates on both sides were extremely passionate, and rightfully so from their perspectives. You know, the hospitals in terms of needing to collect, and the advocates in terms of making sure that the debt collection process was, as I said to the subcommittee this morning, as humane and compassionate as possible. While there were severe compromises on both sides in order to get to this language. I believe that what this does is help get us very close, if not to the place where those who would qualify for free or reduced cost care are going to be have access to all the information, the resources they need in order to access the financial assistance or the free care by virtues of all the things that we put in place that the hospital had to complete in order for before they could, excuse me, got to get the lights on, before they could begin the collection process. Then with the payment plan, basically what we're doing is in developing a plan that is sensitive to a lot of different elements that impact a person's ability to pay and define a financial hardship. So that is in the intent of this policy that's going to be developed by HSCRC would, you know, consider things like not, you know, way beyond the federal poverty level, but rather, you know, that plus all of the other factors like geographic factors, cost of living, the, you know, childcare, all of those things should be part of the consideration in this policy. And so that's what the experts will be developing. It leaves in place a couple of tools that the hospitals can use to support their collection processes, and removes a couple as well. And then we are going to gather information that's going to inform us around the level of issue that this is, which we don't really have a handle on right now, but we know that it is a problem because that medical debt is a problem, particularly for our most vulnerable people, based on a study that was done by HSCRC last year, just on the information they had from 2019, showing that about 60% of the people for whom there were went into the collection process, at least started the collection process, were probably eligible for either free or reduced care. So we think that this bill is going to go a long way towards preventing that. And will get us in, we will have information that we will be able to use as we think about how to make this a process that gets the hospitals the remuneration that they need for the services they provide, but also does in a way that says, you know, healthcare is essential. It's not a car. It's not a refrigerator. It's not something you have choices about. And it's very expensive. And we have to help folks figure out how how they can pay it back when they're able to do that. So with that, I think I would move the amendments to the bill.
Second.
I see Delegate Kipke has a hand raised. Would you like to discuss this bill?
So I would, Madam Chairman, and I want to commend the subcommittee chairman who has done heroic work to bring forward a bill that I think will help a lot of people. It wasn't easy because there's two very strong-willed competing interests. There is one aspect of the bill, though, that I'd like to raise for the committee to think of. And I mentioned it in subcommittee, and there was some bipartisan shared about my thoughts. We, as the bill will be before us as amended, it still will prohibit an individual's estate from having action taken to recoup owed debt. And while I'm very sympathetic to that for people who are in poverty, extremely sympathetic to that, I have no sympathy for people who have the ability to pay and chose not to. In our Medicaid system, for example, if you have low income, you're eligible for Medicaid, and they don't consider some of your assets. But once you die, if you don't have, dependents and et cetera, they can collect from your estate. I think that's appropriate. I personally know individuals. I brought up the example of my uncle who passed away last year. He has no dependents, and he owed money, and they waited until he passed, and then they made a claim against his estate, $8,000, and his brothers and sisters are just going to have that $8,000 reduced from the money that that they're getting out of their brother's estate. So I don't know how to do it. That's the challenge. I think the HSCRC should be empowered to figure this out. We don't want poor people who are in dire straits economically to be harmed. But I do think for individuals who are, there are people who have many hundreds of thousands of dollars in retirement savings and in the equity in their house. There should be a way to have that money paid. Every dollar that doesn't get repaid, is going to be paid for through insurance rates. And so I think there should be some flexibility here, which, I would even say the advocates who are not on the side of the hospitals in here, I would think they'd have some sympathy to the idea that people with no dependents who have a great sum of money in their estate, that's the first person who should be paid would be the system to ensure that rates don't go up. So I just put that out there. I don't know how to word that. But I think it should be considered, and I don't know, we could maybe consider that after the committee's amendments are adopted. But that's one concern I have. If that concern is resolved, I really want to vote for the bill. I think it's a really good thing that we're doing here. But if that's not resolved, I just feel like it was an unnecessary misstep on our part as a policy matter. And I'll have to vote against the bill. Thank you.
Delegate Cullison, would you respond to that, please?
I think the worry that we had, I understand and really appreciate Delegate Kipke's comments. And The concern that we had was folks losing their home. When a parent or a spouse died and left them in debt, and we heard that from from someone who came to testify to us. So I think that was the motivation behind prohibiting the collection against an estate. And we thought, and in the case of the gentleman who came to see us, it was all that he had. And he ended up, I don't think he ended up losing it completely, but he did, suffer through a pretty difficult time.
Is there anything in the bill that goes to studying this piece of things that seems to have some?
Madam Chair, in the bill, it clearly says that a hospital may not get a lien against a patient's primary residence. So that has been already taken care of in the bill. So nobody's primary residence can be attached. So that situation that the young man said, it says on page 8, line whatever, a hospital may not request a lien against a patient's primary residence in an action to collect debt owed on a hospital bill. So that is not allowed in this bill. And I think that's appropriate. So that situation would not apply here on your home, your primary residence.
Okay. Is there study language about this at all, or in general study language about?
There is
forward?
not. No,
Thank you.
We sort of discussed it this afternoon, but we didn't arrive at it.
Thank you. I think next we will move to Delegate Lewis Young. I can't hear you. You need to unmute. You need to unmute Delegate Lewis Young.
No, it's not working.
We're going to come back to you. We're going to go to Delegate Hill, then we'll come back to Delegate Lewis Young because we can't
Just
hear.
got it. Thanks.
Okay.
My screen flew away from me for a minute. We had this discussion extensively in subcommittee. So since I had a little bit of time, I pulled a couple of studies. Reputable organizations, one of which was the Kaiser Foundation. Obviously, 10 o'clock at night, you all don't want to hear a lot of stats. But the short story is that most medical debt in this country is from hospitals. And most of the people that have that debt are very poor. It's not people who have estates. That is the rare, unusual exception. And I'm glad to share these studies. They're not Maryland, but they're national. I'm happy to send anyone that wants to the links.
Thank you. Delegate Hill.
Thank you. I wanted to ask Delegate Cullison whether the committee had spoken with the AG's office. I know there's a lot of work being done to make sure that that family home can be passed on for taxes and all that. And I think Delegate Kipsky's point about making sure we don't create scofflaws, folks who, including being able to, if someone has the wealth and is just not paying, that's very different than if someone is not paying because they can't pay. And I just wondered if you got the AG's opinion about how you can thread that needle to make sure that we're the vast majority of people who we're trying to take care of don't draw in people who actually can pay or die before they don't, and the estate doesn't have any debt.
So the answer to the question, Delegate Hill, is no. I did not consult with the Attorney General about this issue. So I don't have that information for you.
So I would recommend, I think that there are ways to do this. Knowing what the current protections are and how we have, I just think there's a better way to do it. We can do both things.
Let me ask a question, if this would work with the members, in particular the members who have a problem with this issue. If we were to pass the bill the way it is now and put study language in to see what happens in the next year, And if we find that there is a problem in the next year, because the information will be collectible, I believe, through the HSCRC, they'll have the data. We can put a 2-year sunset on this and hopefully come back next year and address this issue if it needs to be addressed. And then we can have the kind of time we need to solve the threshold issue. Threshold issues are very difficult. AGs may need to be involved in them so we're not discriminating. There are all kinds of things that I'm concerned about with this, how you define who does and who doesn't pay. I do think people try to pay their bills. There are some people who won't. There's no doubt about it. There are bad people in the world who try to get away with things, and there are a lot of good people. And I'm wondering if looking at this over the interim, it would soothe the concerns that there are. And then next year we can revisit this issue, this one particular piece. And there may be other pieces we need to revisit then too. I don't know. Does that suit Delegate Krebs, Delegate Hill, Delegate Kipke?
Madam Chair, I mean, I understand what you're saying, but I'd almost rather do it in reverse. First of all, to keep in mind, one of the reasons we're being careful of this is because any limiting the ability to collect debt, which I agree with all the things that we've done in this bill. It's a lot of good stuff.
You went into mute, Delegate Krebs. You
You
accidentally
muted yourself.
My
Right.
paper muted me.
Though I've been tempted to do that once or twice, doing it to yourself is really.
At the end of the day, we're trying to make sure uncompensated care doesn't get out of control by people who really can pay. And right now, if you pass away, your estate, and everyone on the screen hopefully has an estate because you own something. You own something, you have some assets, you have some worth. And it's not wealth necessarily, it's just worth. But if you pass away, your credit card company, you got to pay your bill. Your car loan, you got to pay your car loan. Your house payment, you got to settle up. All those people you've got to pay. And in this bill, the way we've written it, it says you don't have to pay your hospital bill because a hospital may not make a claim against the estate of a deceased payment. So, I mean, whether you feel like you owe it or not, basically we're telling them you don't have to. And some people have, it's not wealth, it's just you have resources. And it seems to me if you got the resources to pay for your credit card bill, you should have to make good on your medical care, which is probably the most important thing you can purchase in your life is your health care. So I'm concerned about the pressure on the uncompensated care. And I would almost rather do and even in I was told by the Hospital Association that even in Medicaid, they're allowed to make claims against an estate. So this would be very unusual to not be able to make any claim against, I say an estate, the person's assets. So if we're going to do a study, I think it'd be better to leave this the way it is now and do the study and say, is it a problem that they're going against people? They had proposed an amendment that the Hospital Association just basically said a hospital may not make a claim against the estate of a deceased payment to collect a debt owed on a hospital bill if the deceased payment was known by the hospital to be eligible for free care under this subtitle, or if the value of the estate after tax obligations are fulfilled is less than half of the debt owed. The hospital may offer the ability for the family of the patient to apply for financial assistance. They're not trying to bankrupt anybody. We have the protection for the home already in the bill on the primary residence. But we're just trying to say, if you've got resources, you should make good on your hospital bill, like you're going to on everything else that you may.
I got it, Delegate Krebs. Delegate Cullison, was this amendment discussed in subcommittee?
It was not, no, not that particular amendment.
Okay. I'm going to hold this because I don't know the answer and I don't think most of us know the answer, and I want everybody to be as comfortable as we can with this bill. So we're going to hold this bill. We're going to have a couple more voting sessions, and they're going to be whenever we have little breaks, like after the hearing tomorrow or before. I don't know. Tomorrow's going to be a complicated day, which we'll talk about later. But I think this issue needs to be addressed. Delegate Cullison, you have a look on your face like maybe you want to say something?
No, I appreciate your willingness
Okay.
to hold it and come back to it tomorrow. But in the meantime, we'll discuss it a little bit more.
Yeah.
Right.
Thank you.
Thank you.
Okay. House Bill 600, Tyler.
Excuse me while I get to the right bill. House Bill.
Surprise, we got there quicker than you expected, huh?
House Bill 600 alters provisions regarding nominations of members to the State Board of Examiners for audiologists, hearing aid dispensers, and speech language pathologists, and then also requires the board to maintain a list of licensees and make that list available. Requires licensees or provides for how licensees can represent and identify themselves in public, and brings in other related provisions, including some for courses, information on courses in cultural and linguistic competency. There was an amendment offered and adopted that just modifies that updated membership nomination process to respond to concerns with maybe expense and complications with the balloting process. And so it'll be a little bit more streamlined, something that the board can manage with its current resources, is my understanding. This is sponsored, and the bill as well as the amendment were sponsored by Delegate Belcastro. It went to Health Occupations and was supported unanimously.
Delegate Kelly.
Thank you, Madam Chairman. The amendments and the bill passed unanimously. The Audiology Board, I think, are our board of the year. They've been very cooperative. And this is a simple bill, but I would like to move the amendments.
Second.
Any discussion? All those in favor of the amendment say aye. Your hand is up, Delegate Kipke. Is there a reason for that? Did I not call on you?
No.
You had a thumbs up.
I was given Delegate Belcastro a big thumbs up.
Thank you. All those in favor of the amendment say aye. All those opposed, no. Raise your hand. I see no hands on the panel. It passes unanimously. Delegate Kelly.
Move the bill as amended.
Second.
Discussion. All those in favor say aye. All those opposed, no. Please raise your hand. Seeing no hands, the bill passes unanimously. House Bill 758. Tyler.
House Bill 758 establishes a licensing and regulatory system for licensed certified midwife to practice certified midwifery under the State Board of Nursing. The State Board of Nursing must establish standards for the practice and maintain a list of licensed midwives and set applicable fees, disciplinary action, and other related technical additions, and provides for specifics of disciplinary action and potential requisite training for disciplined licensed certified midwives.
Delegate Kelly. Oh, sorry.
I was just gonna say it was passed, the amendment and the bill itself passed unanimously in subcommittee.
Delegate Kelly.
Yes, so these are the midwives who are folks who have a bachelor's degree in some other field, who then go straight to midwifery school. So they are well-respected, really often career changers. Everybody was lined up on this. The ACOG is supportive, the nurse midwives are supportive, et cetera. And the subcommittee was unanimous. Move the amendment.
Second.
Discussion. All those in favor say aye. All those opposed, no. Have it. Section on the bill.
Move the bill as amended.
Second.
Oh, sorry.
Right. All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimous. House Bill 7.
Go back and get his license.
I'm sorry.
What?
I said, should Delegate Kipke go back and get his license?
I think that would be appropriate. Yes.
I have an honorary certification.
How many hours did you put in, and did you get any CMEs for all that delivery?
Well, you already
I
did
had
a
an eye
residency.
twitch for about a week.
Oh my.
Don't tell us what your daughter has going on. You had a whole nother thing.
House Bill 783. Aaron.
Bill establishes a work group on screening related to adverse childhood experiences that will be staffed by the Department of Health. The work group will submit a report of its findings and recommendations by October 1st, 2022. The amendments on the bill that were adopted in the Public Health and Minority Health Disparities add a representative from the State Domestic Violence Coalition and Baltimore City's Trauma Informed Care Task Force.
Thank you, Chairman Pendergrass. Thank you, Aaron. We discussed this bill in committee. I believe we had 2 people, am I right? That voted against it, party line. And this is why the bill is needed. Research shows that experiencing trauma during childhood can have lifelong effects. Some stay with us and impact our development mentally, physically, emotionally for years to come. Facing, adverse experiences, which is defined and it's in the CDC, the definition, and there are many hundreds of studies that actually define it. Adverse childhood experiences, called ACEs, are potentially traumatic events that occurred in a child's life, such as physical or emotional abuse. There's 10 ACEs, and they're physical abuse, sexual abuse, verbal abuse, physical neglect, emotional neglect, a family member who's depressed or diagnosed with other mental illness, a family member who is addicted to alcohol or another substance, a family member who's in prison, witnessing a mother being abused, losing a parent to separation or divorce. And many kids experience that. So what the research shows is that kids that experience this have a high risk later on in life of suffering from depression, not being able to hold a job, having a substance abuse disorder, a chronic illness. Like, the data is so clear on it. So basically, why we need this bill is needed because it will help our children in Maryland. It is a task force, and it has a lot of great, professionals that will come together, and they would, be charged with updating and improving and developing screening tool for use by the primary care providers. Every child that enters our school system has to have at least one primary care provider exam before they enter the school. And basically, they also have to make recommendations for the annual survey. And finally, the work group will submit recommendations regarding ACEs screening to the Maryland Department of Education and the Maryland Department of Health.
Would you like to move the amendments, Delegate?
Amendments.
Second.
Second. I see Delegate Chisholm. Wait, let me make sure of the order. Delegate Shalega, then Delegate Krebs, then Delegate Chisholm.
Thank you, Madam Chair. I wanted to just thank the chair of the subcommittee. I did vote against this bill, and she was flexible in trying to find some kind of amendment, and I just want to verbally acknowledge her willingness to work with me to try to find a way to support this bill. I believe that right now the Department of Health should be focused on COVID. The Department of Education should get our kids back in school. I'd like to see these departments focused on those things and more. I find that the bill just doesn't have enough emphasis on family. And I think it's important that parents and family have a bigger role in how this is rolling out. So, that is my opposition, but I do appreciate Delegate Peggy Melnick's willingness to help try to find a way to satisfy my concerns. Thank you.
Thank you so much for saying that. And I really appreciate it. The task force has two parents. And as I offered this morning, if you wanted more, I was willing to be open. So thank you so much. I really appreciate it.
Okay, next is Delegate Krebs.
Thank you. I noticed there were a lot of advocates, obviously mental health advocates that were in favor of the bill, but I happened to see just some letters of information from the Maryland Department of Education. And when I read it, it sort of bothered me. And it says the effect of this legislation will impact families in a very personal way by asking about trauma, including but not limited to abuse, physical, verbal, sexual, emotional neglect, parental issues such as alcohol use, domestic violence, family member in jail, or family member diagnosed with mental illness or other issues such as divorce, death, abandonment, and I could go on. I am becoming more and more concerned about people other than parents. And I know some people think parents, there are bad parents, but there's a lot of good parents. And having strange people interrogate kids or ask kids about all of these personal issues about a family, I just think it's going too far. I know it's a work group, but at some point, people all have things that go on in their lives, and we are now putting this all documented. It's going to be part of the possibly part of the physical examination the kids go through with their doctors, and we're separating more and more kids from their families, from their parents.
And I just don't like the direction that we're moving in. And I also agree with Douglas Schlega about our focus right now on health should be getting our kids back to school. But just the whole direction of this, not doing it with parents that have problems, just bringing every kid in and doing a trauma-based evaluation separate from the parents, I have a real problem. Me personally, I'm glad I'm not a parent of school-age kids anymore. But I just am uncomfortable with the whole premise of the direction this is moving. So I will respectfully be voting no.
Thank you,
And I-
Delegate Krebs.
Thank you.
Delegate Chisholm.
I too agree that if you look at the survey, it's very probing, but I actually take a little different approach than Delegate Krebs. There's not a single person that would deny that ACEs is real. What happens to you at a very young age is very impressionable on you. It'll shape the rest of your life. My concern was, even though these are anonymous questions at times, we're asking about sexual abuse, we're asking about domestic abuse. We're now probing a kid for this information, and now we put a third party in the middle of it that has real criminal intent or criminal aspects to it. I think there's a lot of pitfalls in this, and I'm very concerned about the depth of the questioning. We all pray that domestic violence, sexual abuse, all of that ends, because we know it has a very negative, detrimental effect on society. But I looked at it and I was like, well, we're not even addressing that. We're looking at this like almost as if we take care of the child, now it's fixed. That's not always the case. The root of the problem was way back when, and I'd rather we focus on that type of stuff. And that's why I was against the bill.
Delegate Pena-Melnick, would you like to talk about some of these concerns that were raised? I assume they were raised in the subcommittee.
Yes, so I would say that the composition of the task force addresses a lot of the concerns they have. So you have, for example, you have someone that has behavioral health expert, one mental health expert, one child welfare expert, you have a nurse, you have principals, you have parents on it, you have someone from the Maryland Psychological Association, you have someone from the Psychologists Association, you have assistant coordinator from the mental health services as well. You have, the Maryland Department of Health. You have all these experts that deal with mental health. Basically the objective here is to bring all these professionals, and parents are part of it. There are two parents that can mitigate the impact of childhood trauma so that we can help these kids. The survey that is given to the kids is given twice a year. It's given actually to middle school and high schoolers, no elementary students. And also there's no information on who the child is, so you can identify it as well. But it's a good tool so that the professionals in the schools can see what kind of students do I have here? What kind of issues do they have at home? What can I do, for example, with a PTA, have a workshop and create and give information to the students so that it is easily accessible to them. So I think that the bill is drafted in such a manner that is well balanced, and it has professionals. And at the end of the day, you have to trust our professionals. In addition, I like to reference to the Maryland State Association, Maryland State Education Association. They actually supported the bill with amendments, which we included the people that they requested. And they represent 75,000 educators and school employees in Maryland. And they basically believe that it says here that every Maryland child is a whole child, one that needs to feel healthy, safe, engaged, supported, and challenged in order to eventually see success in college, career, and life. In advocating for the needs of the whole child, we have to basically, what they say is be aware of all these issues. And while they have some concern, they came to the conclusion that when you balance that, this is worth, looking into and see what recommendations are made.
I agree, and I understand. and I know this is a heavy subject, but this is a serious point. If you start asking high school or middle school kids, boys, about their sexual history, I'm telling you, they're all going to lie. They will. Some of them are going to lie. So I don't know the validity of the surveys sometimes. And once again, if we really want to help these kids, it's got to start from the beginning before they're actually hurt. And I appreciate the study. I don't always know about anonymous surveys and who's filling them out correctly. And
Yeah.
you know,
And if I-
I'm going to stop the discussion here. I'm going to say that I don't think that there's a meeting of the minds on this because it's a study and it's putting a group together to put the study together to be implemented. I think we need to leave it with the professionals to do it. I think there are people who are going to have to vote no on this bill, and I don't see how we get from making slight changes to voting yes or voting no. So I think that you've explained your positions really well and they're perfectly reasonable, but I just don't see where we're going to get to a medium here.
I just asked another question.
No, I'm going to call on Delegate Banderi because his hand was up.
Thank you, Madam Chair. If it is done correctly, survey has a validity. And this is the study. I think this is a good bill.
Okay, you know what? I'll give you 1 minute, Delegate Krebs, and
I just
also
wanted to ask, I want to ask a question. I'm reading the letter from MSDE. We did the Handle with Care program. We just passed an initiative last year with the trauma-informed approach. We've been doing a lot of these things. I feel like some people don't maybe know what we're doing. So how are those things going? How's Handle with Care? How's trauma-informed? I mean, they're just trying to implement all that. Now we're doing another work group. So it'd be nice to know like what we've already done, how it's
I
going.
would think the work group would be looking at that too, Delegate Krebs. I would think that they would because they're the same sort of professionals and they're going to be dealing with the same sort of children in the schools. So I think I understand you don't like the bill. Delegate Chisholm, did you want to say something? Your hand's still up. That's why I asked. Okay. You got it up there. Oh, I thought maybe it was in advance. No, which is fair enough. Did you make a motion on the amendments?
No,
I
I'm
think you
going
did.
to say, like my colleague, Delegate Shalega said this morning, it's just different philosophical views, and I respect that, I really do. I would love to move the amendments, please.
Second.
I think we've had the discussion. All those in favor of the amendment say aye. All those opposed, no. The ayes have it. You want to move the bill, Delegate?
I would like to move the bill as amended, please.
Second.
Is there discussion that we absolutely have to have? All those in favor say aye. All those opposed, no. The ayes have it. Put your hands up if you're a no, please. I need to count and see them I see only 4. I see Morgan, Shalega, Riley, Chisholm, and there's Saab. Is there anyone else who wants to vote no on this bill? Okay. Have you got that, Melissa?
I think
Yeah,
you
but-
missed Krebs.
Elliot
I got
Krebs
it, I
voted
got it.
no.
Oh, Krebs got her hand up too. Okay,
I got it. Thank you.
thank you. Okay, the bill passes not unanimously. House Bill 915, Lisa.
This bill establishes the work group on Black, Latino, and other underrepresented mental health professionals. The University System of Maryland and the Maryland Department of Health are required to provide staff for the work group. A member of the work group may not receive compensation, but is entitled to reimbursement for expenses under standard state travel, and the work group must submit a report of its findings and recommendations to the Governor and General Assembly by July 1st, 2022. The amendments include Asian American Pacific Islanders in the scope of the work group, change references from mental health to behavioral health, add to the membership 2 to 4 representatives of organizations, networks, or associations of behavioral health professionals that are composed of and work to represent and support Black, Latino, Asian American Pacific Islanders, or other underrepresented behavioral health professionals. And the amendments authorize the work group to establish subgroups to assist the work group in carrying out its duties.
Delegate Kelly.
Thank you, Madam Chairman. The subcommittee really liked this work group. Delegate Bandari had the very welcome suggestion to add Asian Americans in to the amendment, which I think the committee thought was universally appropriate. And it actually passed unanimously, so I will move the amendments.
Second.
Discussion? All those in favor of the amendment say aye. All those opposed, no. The ayes have it. Want to move the bill?
Move the bill as amended.
Second.
Second. All those in favor say aye. All those opposed, no. The ayes have it. The bill passes. It looks like unanimously. I see no hands in the panel. I assume you can all translate when I say vote no. What I really mean is put your hands in the panel, right? Okay, I apologize for that. I'm pretty tired. And I seem to be a lot tired on nights. I mean, we seem to have a lot of late voting sessions at this point, for which I'm sorry. You guys have worked really diligently. House Bill 1013, Tyler. I'm sorry, 919, Lisa.
This emergency bill requires the Maryland Insurance Commissioner to enforce a provision of law requiring the payment of clean claims by an administrative service organization responsible for managing care and paying claims for specialty mental health services for Medicaid enrollees. The amendments apply to the administrative service organization's statutory provisions that require the payment of interest on clean claims that are not paid in a timely manner, establish penalties for violations of the clean claim payment law, and authorize the Maryland Insurance Administrator to conduct, the Maryland Insurance Administration to conduct a market conduct examination. The amendments also prohibit an ASO from using state funds or passing through to the state expenses for the market conduct examination, prohibit MIA from requiring the payment of interest or imposing fines or penalties if a certain determination is made that an ASO will use state funds or pass the cost of the interest or penalty to the state, require MIA to submit its findings from clean claim complaint investigations to MDH, require MIA to submit any market conduct examinations of an ASO to specified committees, and establish a termination date for the act.
Delegate Cullison.
Thank you, Madam Chairman. And this bill was actually initially passed by my subcommittee last week, but a question was raised in the intervening time, which made us go back to say if the ASO were being charged fines or penalties or interest, would that cost just be passed back to our Medicaid program? And so we worked with the MIA to come up with the amendments that are in the bill that prevent that. We were able to see a copy, the MIA was able to see a copy of the contract, which also prevented it, but we decided to beef up the language in here so that it's very clear that none of those penalty fines can be passed through back to MDH. So we feel like this bill gives the authority that MIA needs in order to be able to address the issues that the mental health providers have been suffering through for the last year. So, and do it in an emergency fashion, and the commissioner of the MIA is ready to get started as soon as the bill is signed. So with that, I move the amendments.
Second.
Is there discussion of these amendments? All those in favor say aye. All those opposed, no. The ayes have it. It passes unanimously. I see no hands in the panel.
I will move the bill as amended.
Second.
Is there discussion on the bill as amended? I have something to add to this, just so the committee knows. I believe it's $1 million, but I could be wrong about the amount. It's at least $1 million that the Budget Committee has is withholding from the department until this gets better. I'm not sure the exact language anymore. It's been a while since I had the discussion. So there's two-part action here. Well, one part here and another part that pairs with it. So know that the department is getting looked at very hard for the fact that they're in charge of this contractor, and therefore we're not happy with the department or the contractor. So with that, all those in favor of the bill as amended, say aye. All those opposed, no. Please raise your hand in the panel. The bill passes unanimously. House Bill 1013, Tyler, it's back.
House Bill 1013, upon two contingencies, would move Maryland into permanent daylight saving time. The contingencies being approval from Congress and adoption of similar legislation from all states in the Eastern time zone. An amendment adopted in subcommittee would instead just make it contingent on congressional approval and adoption of similar legislation with certain neighboring jurisdictions.
Which includes West Virginia, correct, Tyler?
Well, that was not in the amendment, but there was a discussion, and I don't know the binding nature of the straw poll that you took in our last voting. So we didn't.
Was that a straw poll? I remember it.
Yes.
Actual vote. Oh, it was. Okay, well, that's good. Okay, then we better, Delegate Rosenberg.
Well, that's an accurate summary of the action we took. Yes.
Okay, so we need the amendment about West Virginia. Is that correct, Delegate Rosenberg?
Well, did we vote yesterday on the amendment, making it just the contiguous, not including West Virginia? And then there was discussion, as I recall, to add West Virginia.
Right, I thought we had gotten through that, but I guess we had not.
We voted on
right.
adding West
We voted-
Virginia.
That's right, and I
We voted
saw
on
all
it.
the hands.
And then you held
Right.
it.
Yes.
Yes.
So did you just say we voted on West Virginia, or was it a straw vote?
We voted on West Virginia and then you held it.
That's what I thought had happened.
Yeah, okay.
I think it was a straw
There was a straw
poll.
vote in there somewhere.
Well,
I
that's-
know that.
Yeah, you
I'll tell
said,
you what. I'll tell you what. I have the feeling the straw vote was on the bill or something, but never mind. Let's just get it right. Would somebody move the amendment to add West Virginia to?
I'd like to move the amendment that we add West Virginia as a committee amendment, that we take the vote and it just be added. If it passes, by the time by the time the amendment gets to the floor.
Second.
Any discussion on adding West Virginia? All those in favor say aye. All those opposed, no. Please raise your hands. West Virginia is now one of the states adjacent that needs to be included. So we're completely surrounded, I understand now, right? You got
Correct. That is
my
correct.
geography right?
Yes, it is.
Chesapeake Bay, which isn't a state.
Move the bill.
Second.
All those in favor say aye. All those opposed, no.
Delegate
I have my
Zuniga has her
hand
hand
up for
up. Delegate
discussion.
Zuniga has her hand
I'm
up.
sorry, Delegate Shalega. Please go ahead.
Okay, I would just like to add my 2 cents that Chairman's heard me add before. I think this is a poster child bill of why we're here at 10:30 at night and why we're going to spend a lot of time talking about this on the floor. And we shouldn't be doing this till next year.
Thank you, Delegate Shalega. Point taken. Further discussion? All those in favor say aye. All those opposed, no. Raise your hand in the panel. Okay, I see Bagnall, Sample Hughes, Shalega. I see 3 votes against this bill.
I got
Okay.
it. Thank you.
Okay, thank you. The bill passes with probably 21 votes, although I don't know if anybody is absent at this time. House Bill 1039, Tyler.
House Bill 1039 makes a number of changes to the State Board of Massage Therapy Examiners regarding required criminal background checks for certified members, education requirements, and there was an amendment adopted in subcommittee. The stakeholders accidentally removed a definition provision from the bill that they did not want to remove. And so the bill just restores that language if you remember from the hearing, just clarifying what is not covered by the bill, certain health and spiritual practices, making sure that they are not under the scope and are not required licensure under the board. And it was adopted, and the bill was supported unanimously.
Delegate Kelly.
Thank you, Madam Chairman. Yes, the bill and the amendment were supported unanimously despite the obvious sponsor problem. The amendment makes sure that those body work people who came to testify are not required licensure. Move the amendment.
Any discussion on the amendment? Thank you for the second. All those in favor say aye. All those opposed, no. Please raise your hands. Delegate Kelly. It passes unanimously. Delegate Kelly.
Excellent. Move the bill as amended.
Second.
Thank you. Discussion. All those in favor say aye. All those opposed, no. The ayes have it. It passes unanimously. I see no hands in the panel. House Bill 1091, Tyler.
House Bill 1091 was primarily heard in the Appropriations Committee, where it was voted favorably with amendments. It makes a number of procurement, emergency procurement revisions, including 48-hour reporting window or approval window from the Chief Procurement Officer, clarifying the definition or updating the definition of emergency for the sake of emergency procurements, and bringing a number of reporting requirements for emergency procurements that the agencies would then have to make sure are they're notifying the General Assembly or Board of Public Works after they've been done, and bringing in just a mandatory reporting from the Secretary for the Office of Small Minority and Women Business Affairs, just observing how those types of small businesses are being included in the emergency procurement process and how that is contributing to the state goal. But that's just observing statistics. It's not any new changes to procurement requirements.
It did not go to subcommittee.
That is correct. So we are secondary. I did not see it until we got here, unfortunately.
Did
So
anyone go to the hearing? I see Delegate Kipke, you have your hand. I'm going to call on you.
Thank you, Madam Chairman. I haven't taken much time to look at this, but just looking at the bill testimony, there's quite a bit of opposition from a lot of different groups. I'm wondering if we could hold it, not that I'm trying to derail it because it might be a good idea, but the Maryland Asphalt Association. I mean, there's like 8 different groups that had opposition to the bill. I don't know if I could quickly.
Let's hold it till tomorrow. We've held
I
other
went
bills.
I went to the hearing, so just you asked.
I went to the hearing too, but we weren't involved with the amendment process or anything. It's a pretty large fiscal note on it.
Appropriations hasn't voted apparently either, unless I'm.
They haven't? Usually the prime.
They did.
Okay.
Do you know what the vote was in that committee, anyone?
That actually wasn't recorded. I was told it was party line or near party line, but I don't have the exact details. That wasn't sent over.
It was 16-4.
Thank you.
If I may,
Delegate Rosenberg.
the bill as introduced was based upon the recommendations, the report of the Office of the Legislative Auditor. At our request.
I liked the bill. I haven't seen it with the amendments. I thought it was a good bill.
I don't think anybody's trying to kill this bill, but I do think that since it didn't go to subcommittee and since not everybody was at the hearing, we can take a day to look at this bill before we get back to them. They may not be too happy, but we will need to vote on this tomorrow because we are secondary and they can't put it on the floor until then. But let's see if we can get some better information. Delegate Kipke, I know you're very responsible. Anything you can learn is useful and I appreciate that.
Do we have a reprint of this bill?
Yes, I could share that.
Could you? Yeah.
Could you share that with the whole committee, please? That would be very helpful. Okay. That bill
Madam
is
Chair.
being held. Yes, Delegate Hill.
If we're sharing reprints, we've held a number of bills talking about, would it be possible for reprints on all the bills that we're holding over?
I don't have a problem with that. Can staff figure out which bills we've held and make sure the reprints go, if there are reprints, that they go to all the members? Okay, thank you, staff. I appreciate how hard you're working. Our staff is here at 10:30 at night. They're here in this office. I'm feeling very bad. House Bill 1193, Tyler.
My apologies. 1193 would provide for certified nursing assistants, typically when they go to renew their certificate after 2 years, have to have practiced a minimum of 16 clinical hours in the previous 2 years. This bill brings in an alternative recertification qualification where if they completed certain training courses or continuing education courses that will be approved by the Board of Nursing after the enactment of this bill.
Move the bill.
Was that Delegate? Oh, it was Delegate Kipke, not sounding like Delegate Kelly.
Not at all, but I support his opinion. The subcommittee loved this bill, really good workforce bill. It's going to help folks re-entry into the CNA workforce, which there's a huge shortage of. All of our neighboring states already do this and everybody was on board. So I will second Delegate Kipke's motion.
Okay, is there discussion on this bill? All those in favor say aye, all those opposed no. Oh, Delegate Hill, I see your hand. Sorry, it hides in that particular background especially well. Your hand is up.
No, that shouldn't be a hand up at all. Sorry. Nope.
Okay, all those in favor say aye, all those opposed no. The ayes have it. It appears to be unanimous. I want to go back to the House Bill 1091. I want to say something in terms of context. Because we're secondary on this bill, I don't think we're going to make changes to the bill. I think it's probably giving you a chance to look at it to see if you want to vote up or down. If there's something not too difficult, we may, but we are not primary on this, so please go into it with that mindset. Thank you. So before I turn the page and forget it, I wanted to say that. House Bill 1212, Tyler.
House Bill 1212 as amended would provide for a work group that would study ways that the state could better understand and then develop policies for economically and disadvantaged individuals. And then they
Delegate Rosenberg.
report
Oh,
back.
sorry.
Sorry.
The one amendment, this bill would provide a bonus or set a preference if you are hiring disadvantaged individuals. It would be a study of the issue, and what the additional amendment that the subcommittee offered in addition to what was presented to us would be in response to Delegate Chisholm's reading of the fiscal note, where the existing definition of disadvantaged individual, which is really for purposes of ownership, an ownership entity, is the ceiling is 1.5 million total worth. That the subcommittee clearly felt that would not be appropriate for employees to be considered disadvantaged. So therefore, we would add a study of that aspect to the overall study that this bill becomes. If that,
Do you have an amendment? Because I didn't understand that. What does the amendment look like?
It was included with what Melissa sent out.
Okay.
In the study, there's
I can try again.
point within the amendment. So just one more point for the work group to study is what impact does it currently have on state law that we define economically disadvantaged individual as someone of consumer price index net worth of 1.5 million, and whether changes or maybe qualifying definitions or other adjustments to it need to be enacted. So that would just be one part of the many things that the work group would study and make recommendations on.
Okay, We'll start with Delegate Saab, then Delegate Chisholm.
Thank you, Madam Chairman. I just want to make sure I heard this correctly. Someone that has $1.5 million, it would be considered economically disadvantaged?
That
under
is
this
the
bill?
that is the existing definition in the law and is used under existing law in terms of a minority business. And so this bill references that definition, and that is why, in response to the issue being raised by Delegate Chisholm, we would add to the study a review of the applicability of that definition for purposes of this proposed preference, which is for hiring disadvantaged individuals.
So if I have a company with 4 people or 2 people, I will not qualify for a procurement contract if I don't have someone, or if one of them is worth $1.5 million or less under this bill. I'm still trying to figure this out.
I think it's if one of them is worth $1 million. I don't know if it's the employee, first of all, but I think
Employee.
It's the employee.
if the employee is worth $1.5 million or more, not $1.5 million or less. Then
Well,
you're
yeah, but it still means if you're worth 1.4, you're still considered economically disadvantaged.
Under the provision of law that has been used until now to apply to an owner of a business. And so we would be having that issue studied to what should be the definition of a disadvantaged individual in this proposed new circumstance, which is a preference when you hire disadvantaged individuals. What is the income ceiling? What should be the income ceiling in the law to be considered a disadvantaged individual hiree would be studied under the bill as amended.
So I can tell you without a study, it's a lot less than $1.5 million, but thank you. Thank you, Madam
Well, we've got to
Chairman.
come up with something, right?
I can give you a number, but I don't think this bill is going to do that now. Thank you.
Okay. You could volunteer to be in the work group or whatever, the study, people doing the study. Not as a legislator, as a citizen. Delegate Krebs, then Delegate Chisholm, then Delegate Krebs, then Delegate Shalega.
I just want to add some clarity to it. What it says is 50% of your workers have to be disadvantaged socially and financially. And the actual number for 2021 with inflation adjusted is 1.788 million. So if I had a company and let's say my wife worked for me as a female and made less than or was worth less than 1.788 million, she would then be, I guess, able to put a contract in that's within 10% and be awarded that contract. It just set up a lot of alarms in my head, and I didn't know where some of these numbers came from. And just for everybody's information, my wife is not worth 1.788 million.
She's worth half of everything you have, sir.
I told her today, she's 2 commas over from that. But I thought that the definition was so broad, and maybe Nick Charles knows more about procurement, but I just thought it was way too loose. And I think it runs in direct conflict with some of the real minority businesses that are trying to be awarded some of these procurement contracts. It would be way too easy to move things around and get awarded this. Thank you, Madam Chair.
Thank you, Delegate Chisholm. Next on my list is Delegate Krebs, then Delegate Shalega, then Delegate Johnson.
I haven't read the amendment. I mean, having a work group is a lot better than putting this preference on, because as stated, it's up to somebody economically distressed at $1.8 million, which I don't know if any of you are worth the 1.8. I sure am not. So we'd all qualify, except the white men that are there. You wouldn't qualify, but the women would. But in the testimony, it says from the asphalt people and associated general contractors, the problem they have with meeting these goals is a lack of workers. And I think we tried to, that's the problem is trying to find workers to fill these jobs so that you can get the numbers up. So the energy that, I don't know if it's us or I think there's another bill, the More Jobs for Marylanders Act in 2017 was supposed to, push for these workers to get a CTE program of study so they could get credentialed, so they could get some of these jobs. That's where the energy needs to be, because they want to hire folks, they don't have them to hire. So I don't know if this task force will deal with that, but you can get price preferences forever. And if you don't have the workforce to hire, you can't hire them. So I think that you got to get to the root of the problem, not putting 10% preferences on. So I don't know if I didn't read the amendment, if the work group is going to be more broad-based to look at the real problem.
Tyler, do you want to talk about the makeup of the work group so that Delegate Krebs has some idea of how broad-based it is?
So like what they'll be studying is
who's studying it?
The membership?
Yeah, who's
So the
who's
who?
I assume that's what she was asking. Is that correct, Delegate Krebs? Yes. Is it?
Not just who and what exactly are they studying? As I said, the testimony seems to be not that we need the preference, but we need workers. How do we get workers to fill these jobs so that we could get more minorities in the jobs?
So, sorry, I didn't mean to cut you off, Delegate.
That's all right. Go ahead.
Point 3 that they'll be studying is enhancing job opportunities for socially and economically disadvantaged individuals, looking at what other governmental entities and states have done to enhance opportunities, and then existing research on finding ways to enhance opportunities. So they are studying enhancing job opportunities. I don't know if that speaks directly enough to what you're hoping that they'll be looking at, and that's certainly something that you could, reach out them to, or if you were a member on it, direct them towards, or so forth. Point 3, it's on page 3 of the amendment, which is effectively now the bill. Towards the bottom of page 3, enhancing job opportunities.
Would you like to take a look at this overnight, Delegate Krebs?
No, ma'am, I could say I was going to, I'd be lying because there's no way I'm going to read this. Too tired.
We're not going to vote on it at 8:30 in the morning either.
I have subcommittee at 8:30, so I don't even know if I'm going to have time to read it, so don't worry about it.
Okay, that's fair. Delegate Shalega, followed by Delegate Johnson.
Yeah, I'm on the subcommittee, but I haven't seen a reprint. So can you tell, who's on the work group? Who's on the?
So the amendment, just for everyone, is it's striking the entire bill as it is and just putting in the amendment language. So I think it should be pretty clear reading through, but
Is that what's attached to the packet, that what people got in
I
the?
didn't see it in my packet. Tell us who's on the work group. Who's it made up of?
Member of the Senate appointed by the President Senate, a member of the House appointed by the Speaker, Secretary of General Services, Secretary of Labor, Secretary of Transportation, and then 2 additional members, each appointed by the President of the Senate, Speaker of the House, and the Governor.
And Sid Saab.
Well, hopefully the governor will appoint him.
And those last 6 it encourages that the members of that last group of 6 individuals reflect the racial, gender, and geographic diversity of the state. And then the governor will designate who among that group will, of all of those people I've listed, will chair the work group.
How many total members is it?
6, 7, 8, 9, 10, 11. That's 11.
11 members. Okay, I'd just like to point out, this is our 1, 2, 3, 4, 5, 6, 7, 8th work group or commission that we've created. So just FYI, I'll look for that reprint. If you can send that back out, I do want to read it.
Okay. That's fine. Would you like to hold the bill till tomorrow? Would that help you, Delegate Shalega?
I think there's other questions, so maybe you could get to that.
Okay.
I'll
That's
have my
fine.
other questions answered.
I'm going to go. Delegate Rosenberg, your hand is up. Do you want to insert something here? I'm going to go down the line. Since you're the subcommittee chair, you're entitled to answer things.
Thank you. I would just add that one way it doesn't solve the problem of the scarcity of qualified personnel, employees, is the Kerwin report, because it does clearly say that at 10th grade, education is severe to those who are college bound and those who are bound to other careers. So that is one way to address the shortage that has been raised tonight. Thank you.
Thank you, Delegate Rosenberg. Now we have Delegate Johnson and Delegate Banderi.
Thank you, Madam Chair, but at 8 to 11, I give up on it. I'm gonna.
Delegate Banderi.
Thank you, Madam Chair. I will be very short, 30 minutes, 30 seconds, I'm sorry. This bill, I like the bill because it will fulfill the MBA's, that minority business enterprises goal, that, that there should be at least 29% of the total value of all contract it awards, and it will help us to reach that goal. And there was a lot of opposition that, oh, there is no workforce. Until and unless we don't study something, we don't give the opportunity, there won't be opportunity. So this is a great bill.
Okay. That said, since no one is.
Madam Chair, that's the.
I'm sorry, Delegate Charles, your hand was up, and there's Delegate Banderi again.
Yeah. I just wanted to answer Delegate Chisholm and
yeah, what's up?
To Delegate Krebs' issue. What this bill looks like it does.
I'm still running.
I got a chance to read through it. It kind of piggybacks off of mimicking the federal hub zone program, which helps to fix hiring folks from historically underutilized business zones. So those are some of the most socially, economically disadvantaged people. And so under the federal guidelines, you have to hire at least 30% of the people on a particular contract are within that particular community. So with the hub zone standard, it's a SBA set aside that is built in, and every federal agency is actually graded on that through the SBA scorecard annually. How well they're able to hit hiring at least 30%, awarding hub zone certified contracts. Just because you're hub zone certified, or just because in this particular instance, in this bill, you have the preference points, it doesn't necessarily guarantee you the contract. It just makes you have some points to go towards actually winning an award. Same as being a certified hub zone business through the federal government contracting opportunities. It doesn't guarantee you to win a contract. It just puts you in the position to go after certain awards that are set aside for that. So that's my piece, Delegate Krebs and Delegate Chisholm. We can take it and have more discussion if you want to.
Can I follow up with that real quick? Because I think it's important to the whole committee. Do you know where they got the number from, that 1.5 million that turned into 1.77? Is that from some formula they use?
Yeah, I'm not sure about the $1 million piece.
Okay.
I'm looking at the bill. I don't have the reprint either. I'm looking at the bill on online, and I don't even have the study information within this. So,
okay, thank you.
Good to see all of that.
I think Delegate Rosenberg addressed where that number came from, that it's already in the code. Is that correct, Delegate Rosenberg?
That is correct.
Yeah.
And that is to determine ownership, with regard to ownership of an entity, not employee.
And Madam Chair, I just wanted to chime in one more time. Just what these types of programs do at the end of the day, I see your face. I know we're tired. I know. But look, these type of programs, what they do is it just creates opportunities to help hire folks in underserved communities. That's all it does. And that's across the country. So I'll leave with that.
Okay. Are we going to vote on this bill tonight, or is someone holding this bill? Okay, have we moved the
favorable
amendment,
with the
which is
amendment.
bill? Which is the bill now, right?
Right. Yes.
Okay, all those in favor say aye. All those opposed, no. Please raise your hands.
I'd like to read the bill before I vote on it. So I can't vote for something until I read it.
Well, you didn't ask to hold it, and I gave you the opportunity. We voted.
Yeah, I just got it. I literally just got it. I thought I would have it, but Melissa just sent it to me, so.
Delegate Shalega, I offered to hold the bill. We're past that now, but I'm glad you're reading the bill. I appreciate that very much, the homework that you do. My husband is worried about me now. I have to answer this. Delegate Pena-Melnick, would you move on? Oh, well, and you handle it from here. Count the votes and keep going.
Yes, I can do that. I can do that. So we have, we just took the vote in against people that are not voting for it. Melissa is.
Yeah, I have it. Thank you.
You got it? So what's the vote, Melissa?
It's 18-5.
Okay, great. Thank you. So what's the next bill? So the bill passes, not unanimous, but it passes. Okay. The next bill
Is your bill.
is 1280, correct?
Yes.
All right, so thank you very much. So Erin, will you be so kind and describe the bill for the committee?
House Bill 1280 establishes the Maryland Community Health and Public Safety Center of Excellence within the Governor's Office of Crime Prevention, Youth and Victim Services. The center's activities must include strategic planning, technical assistance, and state and local government coordination for carrying out its purposes. The bill establishes priorities for dispersing any federal funds the center receives and requires each local jurisdiction to develop a 2-year community health and public safety plan. The center must produce and update a specified statewide strategic plan by December 1st, 2021, and each year thereafter. There are amendments that were adopted in the Public Health and Minority Health Disparities Subcommittee. The amendments require the center to continuously monitor and analyze their plans for opportunities to reduce and eliminate disparities in the criminalization of racial minorities with behavioral health disorders. The amendments require the office to appoint certain individuals to oversee the center, authorize the center to coordinate with the Justice Reinvestment Oversight Board, and provide for the intent of the General Assembly that the center apply for certain federal grant funding. And the amendment alters the requirements for the strategic plan and the 2-year plan that are required for local jurisdictions.
So we discussed this bill in committee and the vote was unanimous. Am I right, Erin? It's been a long day. It was unanimous.
Yes, it was.
So this bill actually came out of the Maryland Commission to Study Mental Health and Behavioral Health that the Lieutenant Governor actually, he leads it. He sent everyone this booklet. You probably got it in your office, and it's the Maryland Lieutenant Governor Commission to Study Mental Health and Behavioral Health. And he held a summit this past summer. It was a state summit on behavioral health in the justice system using the sequential intercept mapping initiative. This is actually recommendation number 2, this bill that you have in front of you. We had he wrote a letter to the committee supporting it. We had Jake from his office and Senator Hester, who's been leading it in the Senate. It is exactly what Erin just said. And the purpose of this bill is to try to keep people from they have behavioral health from being in the criminal justice system. So we have learned over the years that many people that end up in jail, in prison, some of them are sick and they don't get any help. So this center is supposed to basically act as a statewide information repository for behavioral health treatment and diversion programs. And that was what was decided this past summer with the Lieutenant Governor, that they discovered that there's not a centralized unit. In this way, this center will be able to develop strategic plan and basically share it with the locals, help the locals implement these programs, help them get grant as well. And the vote was unanimous. So is there a discussion on the bill?
Don't oversell it, Chairman.
Thank you. All right. Oh, great. On the amendments, may I have a motion, please?
Yes.
Move the amendments.
It's been moved in second. Any discussion on the amendments? Any concerns? Seeing none, on the bill as amended.
Move the bill.
Second.
It's been moved in second. Are there any discussions or concerns?
No, good night.
None? All those in favor say aye.
Aye.
Will you raise your hand? I don't see anyone opposed, so it's unanimous. Thank you so much.
Thank you, Madam Chair, for doing such a graceful job of this for your first time running a voting session. I would like the subcommittee chairs to remind members when the subcommittees are meeting tomorrow. We need to talk schedule for a minute and then you'll be gone. So Delegate Penny Melnick, you're first. Delegate Cullison, you're second.
The subcommittee, our subcommittee on public health is meeting at 11 in the morning.
Insurance and pharmaceuticals is meeting at 8:30 tomorrow. One bill.
Delegate Rosenberg.
8 o'clock.
Delegate Kelly.
Health occupations is done. Thank you, everybody.
Congratulations.
Until after crossover. when we
Jealous.
meet again.
We are going to be moving our hearing tomorrow to after session. So after we get off the floor, which we think will be around 4 or 4:30, we're going to have our hearing. And we will probably have a voting session at some point, not sure when, probably after the hearing. We'll see what comes out of the subcommittees tomorrow, and we'll try to deal with the held bills. Thank you all for all your tenacity. I really appreciate your doing this tonight. I'm sorry.
Madam Chair, can I ask a question?
Yes, ma'am.
Could somebody who knows how to do so take a screenshot of us? Because I'm really sick of all the other committees are bragging that they're working late, but no one's working later than us. So Heather's usually good at that. I can never figure it out. Quick screenshot. Everybody smile.
I'll tell you what, I got a simple way.
But Madam Speaker, then we won't see you really. It's not, let Heather do it.
That's true. Let Heather do it. I can only do it on a Mac.
It's not bragging. On the screen, she's her phone. She's on the screen.
It's not bragging, it's complaining.
Oh, I am on the screen when I take a picture.
1 second.
But anyway, you got it, Heather?
Not yet. Give me 1 minute, 1 second. And
I love.
Everyone smile. Smile. We got it.
I love that you made fun and made the best of this. I know it's really late and I do apologize. Get a good night's sleep.
Thank